Today what we're going to do is we're going to do our planning. So in the new TOC, we are giving 14 minutes to do our planning. So what you need is your pen, your observation chart, which you've done on your assessment process, your scenario for your assessment, and the actual planning form that you need to fill up, which you're going to create 2 problems from your assessment process that you've done. So with this case, my patient is actually a patient who had laparoscopic hemicolectomy. So according to the assessment that I've done a while ago, the assessment of the patient is complaining of pain. So my first problem that I need to create on my planning part, on the first one is planning, is actually about the pain. So I can say here that Ash is experiencing abdominal pain following uncomplicated laparoscopic hemicolectomy. So after that, you're going to identify the aims of the care that you provided to Ash, which your aim is for Ash to verbalize relief from abdominal pain, from mild or to no pain at all. Your re-evaluation date will actually depends on what is the problem that you are what you've wrote on your planning. So my re-evaluation date is today's date, which is my exact date of today, which is my exam date as well. And it would be followed by every 15 to 30 minutes of nursing intervention or sooner if Ash clinical condition changes. So why I choose 15 to 30 minutes, it's because you can't leave the pain for too long. So you need to make sure that you are actually attending the patient as soon as possible. So in the nursing intervention, if you notice, we've got nursing intervention. There's no specific of how many nursing intervention you're going to write on it. But make sure they are all applicable to your nursing problem. So the first one is make sure that you've explained the procedure to your patient. Make sure that you safeguard the privacy and the dignity of your patient. Followed by your observation, which you're going to get your observation from your assessment process. Always remember that your observation process works as well for the time. If your patient has been operated already, the patient's observation is invalid anymore. So what you're going to do is monitor, because the patient is already post-operative. What you're going to do is assess, record, and monitor patient's observation every 15 to 30 minutes as your patient came out from theater post-laparoscopic hemicolectomy. And then followed by, if your patient has analgesia, make sure that you've given the analgesia if it's prescribed, and make sure that you put your patient in a comfortable position, and make sure that the patient can do deep breathing exercises to relieve your pain. And then you can refer the patient to a pain management team using SBAR approach with the patient's consent as well. And then make sure at the end that you put that the call bell is within the reach of the patient, and finally you can do the documentation at the end of it. So make sure at the end that you always put your printed name at the bottom part, and make sure to put the date as well and the time of the exam. So that's my first problem for my patient. Then you've got the second problem. So your second problem is whatever is applicable again to your patient. So my second problem is Ash is actually at risk of developing infection following laparoscopic hemicolectomy. And my aims for that is to make sure that I reduce, if not eliminate, Ash risk for developing infection and maintain his safety at all times. My re-evaluation for this time is within the end of the shift, or I could do it within 24 hours, or if the patient conditions changes. So as noted, we're going to do nursing intervention. This intervention is actually depending again of what is your problem that you've utilized for your patient. So my first one, because my problem is risk for infection, is ensure that PPE are readily available in Asha's bedside and is strictly adhered to. Next one is I'm going to make sure that educate Ash effectively in a way of performing her hand washing technique to prevent any infection. And then I can administer any antimicrobials if it's prescribed to the patient. And I can offer some information regarding how to prevent infection and how to look after the patient's wound. Make sure to highlight to the relatives and to the patient as well proper hand washing before entering to the ward, and make sure doing it after going out of the room of the patient. And make sure to highlight to the patient the benefits of healthy eating as well as well-balanced diet as well. Then make sure that we provide health teaching to the family as well as to the patient the benefits of adherence to the medication for the faster recovery of the patient. Again, at the end of it, there will be a printed name again, and then the signature and the date and the time of your exam. So that's your second problem. Always make sure that you have two problems. First is your main problem, followed by the second problem. If you notice in your exam, you will be provided another page, a third page for problem. This is only going to be utilized if you made a mistakes on your first or second problem, and then you can utilize this as your next page. So, but if not, most commonly, we will only use first page and second page, which is your first problem and your second problem. So, the actual planning and evaluation and the problem that you're going to create is actually depends on the scenario that you've been given, which is actually in front of this, which the scenario will be given, as well as you will have your time of your scenario as well, which you're going to follow. So for now, that's it for your planning.